Good morning. How's the world treating all of you today? Good to see you. Good morning. I'm going to give you all a second, okay? Good morning. Always like to allow a minute for all of you to click, join in, say hi, wave. Good morning. So it's been a good day, good week so far. I hope you guys have seen the same. Yesterday we talked about vitamin K, which is a fat-soluble vitamin. And today we're going to talk about vitamin D, which is honestly, I'm going to talk about the basics of vitamin D, kind of like a crash course. But there has been some really cool research with vitamin D recently with our recent times. And I'm going to touch on that a little bit too, because I don't think all of you are hearing about it. So I want to make sure that we talk about everything that vitamin D can do and how it's so important right now for what we're all dealing with. So nice to see all of you. I am Dr. Tricia Pingle. This is your morning checkup. My light on Instagram's a little dark. Sorry, guys. I think Facebook, I don't know what's going on. Must be weird light coming through the window. But anyway, we'll just go with it. So we're going to talk about vitamin D, okay? Now, I don't know if you know this. This is quite shocking, but almost half of America, 46.1% to be exact, are deficient in vitamin D. Yet, I want you to think about this. Our main sources of dietary vitamin D are fortified processed foods and meats and dairy, okay? Now, America is eating plenty of that. They're eating plenty of processed foods, plenty of meat, plenty of dairy. In my opinion, far too much. Yet, if everyone's eating the foods that supposedly give us vitamin D, why are half of us deficient? Just think about that for a second. This isn't simply about eating. Vitamin D, the biochemistry of vitamin D can be quite complicated. And I'm not going to bore you with all little tiny details, but the bottom line is there's more to it than simply dietary intake. There's a lot of factors that play here, and vitamin D is incredibly important for multiple areas of our health. And more recently, we're seeing a lot of the ties between vitamin D and not only COVID improvement once you're infected, but also prevention of COVID. I know, I said it. I'm going to talk about it because the research is unbelievable. We don't talk about this enough, but vitamin D is very important to your health in general. Hello, good morning. Good morning to all of you popping in and saying good morning. I'm Dr. Tricia Pingle. This is your morning checkup. To those of you that are new, so nice to meet you. Welcome. I'm here every day, Monday through Friday, 9:15 for the most part. And for all of you that are back, welcome back. Good morning. I hope you enjoyed yesterday's talk. So I just figured we'd continue the fat-soluble vitamin train today. Okay, so half of America is deficient, yet the majority of America eats fortified vitamin D foods. What the heck is going on? If you've been told that you have low vitamin D levels, your doctor may have said to supplement or eat more fortified grains, fortified dairy products, meat products such as fish, eggs, and red meat. But I think we eat enough of that. I don't think that's the problem. I don't think consuming vitamin D is our issue, right? Do you? So if we look at the holistic viewpoint on why are our levels so low, there's a lot of other factors that come into play, right? Now, I do want to say it's worth noting that most of the time when patients come to me and they're asking me about vitamin D, they are often asking about it in regards to bone health. And vitamin D is very important in the health of our bones. However, it extends well beyond our bone health and our skeleton, okay? It does so many wonderful things for your body, and that is why it is so critical that you have healthy levels. And we're finding that even more and more in research, how many more health conditions vitamin D is actually benefiting than we originally thought. So let's talk about it. Cool? All right, I'm ready. All right, so vitamin D is a fat-soluble vitamin. We only have a few of those, okay? One of the things to always pay attention to when you have a fat-soluble vitamin is that those can be overdosed more easily than water-soluble vitamins. Now, most of us are pretty deficient in vitamin D. Many people aren't, but there are certain dosage levels, so this is always something you should talk to your doctor about before you start a vitamin D regimen. But I'm going to tell you how you can screen vitamin D, why it's important, what the different vitamin Ds are, and what the benefits of vitamin D to your health are. So I'll give you as much education as I possibly can. When it comes down to dosing, that is something you work one-on-one with your doctor with, okay? But I will give you a general overview on that as well, okay? So the truth is, vitamin D is not overly present in foods. It's really not. Most of the vitamin D that you're consuming is fortified. So when people say, oh, drink milk, it's fortified with vitamin D, guys. Same as almond milk. It's not the dairy that has vitamin D in it, okay? It's fortified in cow's milk. It's fortified in almond milk. So to me, nut milk and dairy milk, when it comes to vitamin D, are identical, except the dairy is more inflammatory. Right? So that's why I always tend to lead towards the plant sources. But these are fortified levels of things, which means that they are inserting a supplement of vitamin D. Commonly, like in kids' cereals and things like that, commonly you're seeing vitamin D2, okay? Not vitamin D3. And we're going to talk about what that is. Sorry, I woke up this morning sneezing. For any of you in Arizona, everyone is overseeding right now, their grass, and it leads to a lot of sneezing. So pardon me. I sound kind of sneezy. All right. So there are some plant-based food that have vitamin D in them, mushrooms often you hear about, but these are all minimal amounts, okay? There's so much more to vitamin D than simply food intake. You can take vitamin D supplements, which I do usually suggest, especially in our current climate. And also our body helps the manufacturing of vitamin D through our skin from the sun, right? So think about over the last many, many years, the use of sunscreen and how that might be impacting our vitamin D. I'm in Arizona, right? We're in the sun all the time, year round. I mean, I think it rains here like for an hour some days, right? It's usually always blue skies. Yet vitamin D deficiency is so common in Arizona. Why? We used to think, okay, people in the Pacific Northwest, would have more or lower levels of vitamin D than those here in Arizona. I'm not finding that anymore, right? So this isn't simply about sun exposure. I know a lot of people are doing their 10 to 15 minutes a day out in the sun, yet we're still seeing vitamin D deficiencies, right? Why? Supposedly we're eating it. We're going out in the sun, so what is going on, right? I'm coming back to it, I promise. So let's talk about what the differences between all the vitamin Ds are to start. We'll get a little biochemistry lesson, and then we'll dive into why I think our vitamin D levels are dropping and what we need to do about it. All right, so we have these different forms of vitamin D, okay? We're gonna simplify this and say D1, D2, D3, okay? Now, most of us in supplement are taking D3, right? Because that's the most active format of those, okay? So vitamin D can be manufactured in your skin. That starts the process. It can also be consumed as D2 primarily in foods and D3 as supplementation. However, you get it all in there, it has to be metabolized and utilized for action. In order to do that, it must cross the liver to be turned into something called vitamin D25 hydroxy. Now, any of you who have had your vitamin D levels screened by your doctor, most likely that's what they ran, 25D hydroxy, which is vitamin D25OH. So if you look on your lab sheet, that's what that says. Some doctors screen 1,25OH, but it has to get to that point first. So there's a lot of stuff along the way to get to 25OH. Once you get to 25OH, it's for the most part assumed that it's going to be turned into something active. There are cases where I have seen that it hasn't, but in general, that's what most doctors are using to screen. Now, what's driving me crazy, and I'm sure you guys can relate, this is a little bit of a side note, but it drives me crazy. Okay, so we're going to learn about how important vitamin D is in your preventative health, how important it is for vitamin D to be at a certain level to help you fight infection, cancers. It's an antioxidant, anti-aging, bone health. Yet, insurances don't cover it. I don't understand it. It doesn't matter. I swear I get more appeals on my insurance didn't cover vitamin D testing than any other item that I send out. I don't get it. If you work for an insurance company, tell me why. It has been proven, documented, scientific research that vitamin D levels are critical to your health. Yet, if I want to screen someone's vitamin D levels, it gets denied. And you know the only time they cover it is if there's a documented vitamin D deficiency. Well, how am I going to find it if I can't screen for it, folks? So be prepared to pay for that test, but I think it's worth it, okay? I don't understand why they don't cover it. I don't know. Maybe someone can fill me in. Supposedly we're all about preventative, right? And we're not getting it covered. Used to be covered. The private healthcare plans used to cover it. Now the majority of the plans, the HMO plans and stuff, will not cover it. I don't understand. But anyway, all right, off my soapbox, but it makes me mad. Okay, so vitamin D 25-OH is what's regularly screened in your lab levels. Check out your levels there. Below 30 is definitely considered detrimental. Okay? Like to your health. I would say if it's below 30, you need to get it up. Okay? A lot of people, there's a lot of debate about what level it should be. I mean, it could range anywhere from 30 to 100. I typically try to target between 50 and 80. Now, there's also a lot of debate over whether these are accurate, not accurate. Doctors kind of disagree on should we be checking 25-OH, 125-OH. But I will tell you, the research, and some of the ones I'm going to talk about in a minute, are based off the levels of vitamin D 25-OH. Almost all of the research across the board says below 30 is a problem. Okay, so we're going to go off that because that's what the research says. Now, there are, like I said, there's a lot of different angles to that, a lot of different interpretations of that, but I found that to be true as well in clinical practice. So I always try to get it above 30. If I can get it above 40, even better. If I can keep it around 50, 60, I'm usually pretty darn happy, right? And I usually don't see a lot of health consequences when it's at that level. So when you take a look at your labs, see where you're at, talk to your doctor if it's below 30, okay? Really. We're going to talk about the importance of it as well, okay? So, where was I? Oh, yes. So, once it gets to vitamin D 25-OH, it doesn't stop there. That's not the end of it, okay? Then it moves on to your kidneys, and it transforms into 125-OH, 125-hydroxy. This is what goes on to have a massive impact in your body's biochemistry. Now, you can also get that level checked. Pretty much guarantee you they're not going to cover that one either. But if you really want to be comprehensive, you can check both the 25-OH and the 125-OH. Once again, the research is based on the 25-OH for the most part. Now, if you cover your body in sunscreen, you're not going to get to that point. So do think about that. I always recommend being out in the sun 10 to 15 minutes a day, okay, before you put your sunscreen on, okay? Sorry to the dermatologists out there. So, in order to appropriately utilize vitamin D, it has to go through all these processes. You have to have enough sun exposure. You have to have enough intake. It's got to go through the liver. It's got to go through the kidneys. It's got to be metabolized into what it needs. Now, here comes down to why I think we're deficient, despite the fact that we're out in the sun and eating processed crappy foods. Stress. What do we do when we're at rest and not in stress? That's when we do things like convert vitamin D into active vitamin D. When we're running from a bear, we're not doing that. This is my opinion. Guess what vitamin D is made from? Cholesterol. Guess what cortisol is made from? Cholesterol, right? So if the body has some cholesterol and it's stressed and it's running from a bear, it's going to focus on making more cortisol than it's going to focus on the vitamin D pathway. I think that we are not utilizing vitamin D because of the impact of stress on our body. Okay, there are actually research articles out there that are linking vitamin D and cortisol. In fact, researchers have been actively trying to draw a very clear and concrete association, because we see as a physician, I see the link. I see that people who have adrenal fatigue and that are under stress have lower vitamin D levels, right? We see that people that have autoimmune diseases typically have lower vitamin D levels. We see people with cancer tend to have lower vitamin D levels, right? We see the connections. We see people with Hashimoto's disease, lower vitamin D levels, type 2 diabetes, lower vitamin D levels, polycystic ovarian syndrome, lower vitamin D levels, right? And now we're seeing a huge link between vitamin D levels and COVID. Okay, so we see the connection as physicians between vitamin D levels in your health, but what we can't find is a clear and concrete understanding of why, right? So a lot of that is speculation. And that's what most of the research is surrounding right now, is how do we find out exactly what's the pinpoint? Like, what is it that makes that happen? My instinct is it has to do with a play between how cholesterol is used. When you're under stress, your body's not going to do the things that are about regular maintenance, okay? You also have higher inflammation when you're under stress. Inflammation has a negative impact on vitamin D. So I think there's a lot of multifactorial issues here, right? Does that make sense? Why that would be? But it's not just me. I mean, all of us doctors are seeing it. Research is seeing it. We're trying to find it. What is it exactly? What's the optimal level? What's the differences between these conditions? What's this strong association? I guarantee you stress plays a role in there. Stress management is so important. If you are not managing your stress, if your body is in a fight or flight state instead of a rest and digest state, likely your vitamin D levels are going to drop. I'm telling you, they are. You need to be more on top of it. Just like you need to be on top of minerals, you need to be on top of B vitamins. You need to be on top of your diet, your exercise, your mind-body exercises. You need to make sure vitamin D is in there. Now, while I have your attention, let's talk about what nobody really wants to talk. Everyone wants to talk about, but everyone's afraid to talk about. And that's the research right now surrounding COVID and vitamin D levels. I'm sorry, it is fascinating. And I bet you guys aren't seeing it, right? Are you guys seeing it? I know that there's a lot of studies out there that say, vitamin D, so-and-so is taking vitamin D, or, I know it here in the hospitals in Arizona when people are admitted for COVID, zinc, vitamin D, vitamin C are all starting to give those automatically orally, along with some other, I think, famotidine and Remdesivir, but they're using nutrients because of the impact of nutrients on the immune system. We've talked about zinc and its impact on the immune system and the way that it works with T cells and inflammation. So let's talk about vitamin D. There was a study, and this is a recent study, actually quite a few recent studies, all in the last month or two, okay, on looking at patients who were hospitalized with COVID, looking at their nutrient levels, and then following who survives, who has more complications, who doesn't survive, okay? And they've been looking at, is there a way that you can predict who is going to have a more severe outcome than somebody else? Because if we could predict that, we have something preventative. Now, explain to me, like Kelly just said, you haven't read anything about this. Why aren't we reporting this, folks? Why are we reporting all the negative cases and not how many people are, basically improving their health by looking at some of these preventative measures? So I'm going to attempt to talk about it here. Who knows if it'll still be here? But anyway, there was a study. So this, the name of this study was Adequate Levels of Vitamin D Reduces Complications and Death Among COVID-19 Patients. I'm going to quote, okay? And I quote, "This study provides direct evidence that vitamin D sufficiency, which is considered greater than 30 nanograms per ml, can reduce the complications, including the cytokine storm and ultimately death from COVID-19. Okay? So what they did, they took a blood sample to measure the vitamin D status. So they looked at the 25-hydroxy vitamin D, okay? And they took this one from 235 patients that were admitted to the hospital with COVID. So these were severe cases. These were cases that had been admitted, okay? These patients were followed for clinical outcomes, including clinical severity of infection, becoming unconscious, having difficulty in breathing, resulting in hypoxia and death. They also analyzed inflammatory marker, C-reactive protein. So inflammation is one of the reasons why diabetics, obesity, hypertension, any type of inflammatory disorder has a harder time with COVID, is because the inflammation goes up. When that inflammation goes up, you have more likelihood of cytokine storm. Okay, so they were looking at those different aspects of it. Okay. The researchers then compared all these parameters in patients who were vitamin D deficient to those who were vitamin D sufficient. Okay? In patients older than 40 years old, they observed that those patients who were vitamin D sufficient, so they had enough vitamin D, were 51.5% less likely to die from the infection compared to patients who had less than 30 NGs per ml. 51% less likely to die. So if I said you're 51% less likely to have a heart attack if you take this supplement, would you do it? right? Why aren't they talking about this? Why aren't we talking about it? Why is this study like just taken off? On the medical side, like when you hear doctors talking and we're like, saying there's tons of stuff coming down the pipeline, there's tons of valuable treatments, there's all this stuff out there, and you guys are like, like we don't see it. It's there. But anyway, this is not the only study, by the way. I'm just quoting one. In fact, I'll quote a couple others if you'd like, but that's pretty cool. There was also another study that was recently published, I believe it was also in September, that not only found that the severity would be reduced, but they found that having a sufficient amount of vitamin D can reduce the risk of catching coronavirus by 54%. So we've had this common we've had this talk a lot. You know, you have 100 people in a room with the flu, or you have 100 people in the room, you have one person with the flu, right? How many people walk away from the flu? You shake hands, you say hello, you talk, right? How many people walk out with the flu? Not everyone gets it. Everyone might be exposed to it, but not everyone gets it, right? Well, that's true with any virus. Any virus out there. Really, it doesn't even matter which one you pick. If you walk into a room, not everybody will walk out with it. Why not? Right? Because our bodies have immune systems that pick it up and knock it out, and proper nutrition is so important. Okay? So vitamin D, by the way, also shows studies in prevention of the flu, minimal flu symptoms, and we're going to talk about other benefits as well. So this is not exclusive to corona, but I want you to know, because nobody's telling you. Okay? Why do some people have really minimal responses? Why are the majority of those people with minimal responses younger? Do we have vitamin D deficiency in kids? Not so often. Young adults? Maybe, if they have a health condition, right? Older? Absolutely. One of the top deficiencies. Half of America is deficient in vitamin D, right? Right? All right. So, in fact, on that same study where they were saying it reduced the risk of catching coronavirus by 54%, they believe that being vitamin D sufficient helps to fight the consequences from being infected not only with coronavirus, but from other viruses causing upper respiratory tract illnesses, including influenza. Quote, there is a great concern that the combination of an influenza infection and a coronavirus infection could substantially increase hospitalizations and death due to complications from these infections, right? We're all going into the winter. Everyone's panicking. I don't know why we're panicking, because we have the tools, right? We need to use these tools. So make sure your vitamin D levels are sufficient, okay? I will check it out. Thank you. I see your comments on Instagram. I try not to get too much into the political aspect of it, more so the health aspect of it, because the bottom line is, no matter what you think of this virus, whether you think it's minimal, whether you think it's severe, obviously there's wide variations to it depending on the person. So what I want to talk about is what's the difference between the people. I don't want to talk about the virus. The virus is a virus. It's there. It's not going anywhere. It's going to be here. The difference as to why one person dies from it and one person doesn't has to do with the makeup of the individual person. I firmly believe that. It targets certain people. People with higher inflammatory disorders, lower vitamin D, less, more compromised immune systems. Okay? And higher inflammation. Pay attention to your body. Give your body everything that it needs, okay, to be well. Okay? There are people that are 90 surviving corona. I have a personal friend whose grandmother had it. Was told she had it. She called everyone and said, well, I'm a goner. Started saying goodbye to people. I'm done. I'm out. I've been told I'm old, therefore I'm done. I'm never going to make it. Not realizing that her chance of dying was 3%. But she was calling everyone. 4 days, mild illness, totally fine. Had to call and apologize to everybody. People survive. Some people don't. You could have a 20-year-old with diabetes and obesity that doesn't make it. So what's the difference? Look at nutrition, okay? Look at the body. Look at the ways that we can support ourselves. There's a lot of options out there. There's a ton of research on this. You want to read about it? Type in vitamin D and COVID. Type in zinc and COVID. Type those in. Find the research, okay? All right. Now, In fact, there was another, God, there's so many studies on this, guys. It's unbelievable. I could go on all day. But there's been a couple doctors that have come out and said, they always pay attention to vitamin D levels, as do I. And of all their coronavirus cases so far, no one has passed away, but they all have adequate vitamin D levels. Is that enough to say concretely from experience? No. But then again, we can sit there and say, well, we have experience with antivirals, we have experience with prednisone, we have experience with that, and that's not proven either. I mean, it's just case review, right? So there's a lot of options out there, okay? All right, off that, because if I talk about it too long, people get mad. Why can't you get vitamin D from foods? You can, it's just minimal. It's not an abundant amount. And a lot of the foods that have vitamin D in them are processed, and it's fortified. So it's really a supplement anyway. So ideally, if you have low stress, good digestion, you're really healthy, and you go out in the sun every day, you should be able to have adequate levels of vitamin D. But if you don't, you may need to supplement. Okay? I saw a bunch of comments here. I do want to go into the 4 main areas where vitamin D can help. Since we kind of talked about immune system, we're going to talk about a couple others. Yeah. I think I caught up on Instagram there. Thank you. All right. Some of the questions that you guys are asking over on Facebook, I'm actually going to get into, and then I'll come back. Okay? All right. So what are some of the other amazing vitamin D3 benefits? Okay? 1, potent antioxidant. What's an antioxidant? If something comes in and tries to destroy your cell, an antioxidant prevents it. So think of cancers, think of diseases, think of your susceptibility to infection, things like that. Think of aging. So anytime cellular function is damaged or DNA is damaged, it's antioxidants that come in and repair that. Okay? In addition, vitamin D has been shown in research to prevent the progression of numerous diseases, such as obesity. Many of you don't think about that as a disease, right? It is, and it's an epidemic. Okay? Obesity, type 2 diabetes, high blood pressure, pregnancy complications, dementia, osteoporosis, autoimmune diseases, cancers, and systemic inflammatory diseases. In fact, low vitamin D levels are linked to each of those conditions that I just stated. Okay, so we talk about the diet, 50% of America being deficient in vitamin D, yet our diet is highly fortified with vitamin D, but how many people in America are obese? I think at this point, I want to say overweight or obese was at least 60%. So, I mean, it kind of correlates. What are our rates of cardiovascular disease? Our rates of diabetes, right? They're up there. So it makes sense that vitamin D would be low in the majority of the population because this is what the majority of the population is dealing with, right? Brazil nuts. Yeah, I actually have a live on selenium. I have a live on zinc. And I talk about the Brazil nut. It is the best dietary source of selenium, the Brazil nut. Good call. All right. Okay, so antioxidants. Number 2, because of that, vitamin D can help minimize aging. Right? It's key in the anti-aging world. Now, there is something called glutathione, which is a potent antioxidant that is basically responsible for keeping kind of our body in check, detoxification, immune system regulation, aging, health of cells, those types of things. There's kind of a bi-directional relationship between vitamin D and glutathione. They stimulate each other. They help each other in both different ways. So if you're deficient in vitamin D, you're usually fairly deficient in glutathione and vice versa. So very important thing to consider. It helps by, vitamin D helps by helping the cell growth and fighting inflammation. In fact, there was a study in 2008 that actually determined that vitamin D is now one of the most essential vitamins for the anti-aging process. So for those of you that don't like those wrinkles, make sure your vitamin D is up to par. Number 3, probably one you're most common with, vitamin D can help your bones. How? That's what I want to teach you. I don't just want to give you the, hey, vitamin D will help your bones. Let's find out how. Do any of you know how? Vitamin D actually aids, Kelly, glutathione you mean? Spell glutathione? It is in the vitamin D article under point number 2, but glutathione, glutathione. All right, how does vitamin D help our bones? It helps us absorb calcium from the gut. So, how many out there with osteopenia and osteoporosis are loading up on calcium, thinking that it's helping your bones? If you don't have enough vitamin D, you're not absorbing the calcium to go into your bones. So, there were some studies where they looked at people with vitamin D deficiency and found that the body can only absorb 10 to 15% of dietary calcium compared to 30 to 40% of dietary calcium when vitamin D levels were sufficient. Okay, vitamin D and calcium work together to prevent osteoporosis. Okay, it's also important to note that calcium and vitamin D assisted absorption are not the only vitamins and minerals involved in bone health. You also need magnesium, boron, strontium, manganese, vitamin K. We talk about all of those in different lives as well. The manufacturing, the strength of your bones is reliant on far more than calcium. Okay, but vitamin D's role is to help us absorb it. Okay? So vitamin D deficiency also puts people at increased risk of developing soft bones, which is osteomalacia. Okay, so vitamin D plays a huge role in bone health. Number 4, it does support just your overall bodily function. In fact, recent research suggests that in addition to the intestines, where vitamin D helps to bind calcium absorption, there may be vitamin D receptors in other organs of the body. So some of the other areas that they've seen: heart, muscles, endocrine glands, blood vessels, and the prostate. Okay, so there's receptors there, and vitamin D acts directly on it, causing beneficial health impact. Okay, many studies suggest that using vitamin D may also help protect against high blood pressure, several autoimmune diseases, including multiple sclerosis, psoriasis, and rheumatoid arthritis. In fact, if you're someone with these autoimmune diseases, most likely even your rheumatologist has been checking your vitamin D levels and making sure you're sufficient. If only our insurance covered it. Wouldn't that be nice? I hope that helps explain what vitamin D is. A lot of people ask about the levels. Like I said, I kind of play in the arena, definitely above 30 on 25OH. If I can get it above 40, even better. 50 to 60, 50 to 70 really is a sweet spot for most physicians. That's kind of where we like it. You do not want to take too much, right? We don't want to be over 100 or even over 80. Some doctors kind of start to say, So have your levels checked before you start vitamin D. But once you start it, those are the levels of target. Vitamin D doesn't rise. In my experience, I haven't seen it rise really quickly. So usually I won't retest for a few months because it takes a little bit of time for it to build up in the blood. As far as dosing, the RDA is pretty darn low. They're suggesting, anywhere from 400 to 800 IUs. I think probably most of you take over 1,000, right? If not more. I tend to find most of my clients can take anywhere from, 2,000 to 10,000 a day. I definitely wouldn't go to the higher ends without a physician. There are a lot of people who take high dose once a week. I prefer daily dosing because I feel like our body can only use so much at one time. So if you're giving it in, a 50,000 IU dose once a week, you're kind of loading the body up in a day. And to me, that seems kind of stressful. And we already have enough stress. So I tend to give it more often. Obviously, everyone's health is different. So you should definitely work with your doctor specifically. But just to give you a general range, when I'm looking at some of you over there that are saying what you take, many of you are taking anywhere from 1,000 to 5,000 a day. And I would say that's probably average. I take 5,000 a day. That's me personally. Okay, that doesn't mean that you're supposed to. You definitely need to check with your doctor, but it seems like that's a pretty common range for all of you. So you guys are obviously getting pretty good advice, which is great, okay? But always monitor the levels, see where they're at, and adjust accordingly, okay? So what is the takeaway today, right? Almost half of America is deficient in vitamin D despite eating vitamin D fortified foods. So watch your stress. Pay attention to your body in general. Pay attention to what else might be impacting your ability to manufacture that vitamin D. Are you wearing too much sunscreen? Are you taking supplemental vitamin D3? And what amount should you be taking? How can we help protect our bodies against disease in general, okay? Some of the new research, it's crazy. It's awesome. I love it. I love seeing it, and I'm so sad that you guys don't see it. So when you read reports about them just kind of discounting, oh, this person was taking zinc and vitamin D, or people are taking this or that, or yeah, it's kind of been indicated, look it up. Go to PubMed and look it up. Because they are quoting actual research. It's pretty freaking amazing. There's a lot of research going on. Favorable. Okay. As far as vitamin D supplement, I do want to add one more thing. Some of the most common vitamin D3 supplements that I find at your generalized pharmacy, large warehouse distributors, they tend to be these huge capsules. Vitamin D should not be huge. It should be tiny. It should be a tiny little capsule, and it should be a fat. It should be a capsule. So some people do make it into a powder, and that's fine. But what I'm looking at is what are the additives in it. So a lot of these larger companies put like 500 IUs in soybean oil, and it's this big capsule. So 1,000, my capsules of 5,000 IUs are tiny. So if you're taking 1,000 and you've got a fairly large capsule, it's full of a bunch of junk. It really shouldn't be anything but vitamin D3 and the capsule. It is fairly stable all by itself. In fact, a lot of people also use drops. I tend to use vitamin D drops, and it's literally 1,000 IUs per drop. Drop, not dropper full, drop. That's how little you need for 1,000 IUs. So if you're honking down these big pills, take a look at the label. This should be very easy. Vitamin D is a fat. You can add it. You can just take it as a dropper on your tongue. You can add it to a smoothie. You can take this little tiny capsule, okay? But you want to make sure that it's a pure vitamin D3 with not much else in it, okay? Because that's wasting your money and giving you a lot of stuff you don't need, okay? We don't need more soy in our diet. We get enough of it, okay? So cool. I don't think I saw any other questions. I'll go through real quick. A lot of you are asking, is that too much? Like I said, the ranges, people take anywhere on average from 1,000 to 10,000 per day. So if you're in that range, you're probably in the range, but you should always check with your doctor. I can't give that direct advice over social media, unfortunately. I wish I could, but I cannot. You need to talk to your doctor, right? Is it okay if the other ingredients are medium chain triglyceride oil, coconut, and palm source? I guess, to me, I don't see the point, right? I just don't see the point. Now, if it's an essential fatty acid capsule that has omega-3s plus vitamin D, I guess I could see that, although you're not going to be able to get a lot of vitamin D in there. I just don't see why you'd add it. I don't understand why they add things to supplements. I don't get it. Coconut oil, of course, I love coconut oil. Not sure about palm oil. I don't think I'd want to be taking palm oil in my vitamin D. So I would check if there's another purpose for it, or if it's simply a vitamin D3, it really shouldn't have much else in it. I don't have a sample here today to read a label to you, but check the label, okay? I think 3,000 a day, 5,000, 2,000, yeah, right, 1,800, yeah. You guys are on it. What do I think of maca root? I'll come back to that maybe on a Q&A. It's a totally different, I love it, but I have a lot of thoughts on it. Good morning, Fred. Okay. With everything out there, not knowing if it's a reliable site, what reliable sites do we look for these informative researchers? All right, PubMed.com. PubMed. That's where you look for this research. PubMed. Or it's PubMed.gov. Don't read the Washington Post, the New York Times, CNN, Fox. Don't read media outlets for your research. Do not, please. If you want to know what the doctors are seeing and what we're looking at, PubMed.gov is a great place to search, okay? You want to look for medical journals. So if let's say you read one of these media outlets, let's say you read the Washington Post and it says vitamin D has been linked to, or adequate vitamin D levels are linked to better COVID survival, there should be a source at the end that links to the journal article. If there's no source, you can't find where they're getting it from, you can't link directly to the published article that they're citing, I wouldn't put much weight into it. So I spend more time clicking. So when I read news and there's a big headline, right, I scroll through the article for the link to the actual data. I don't spend much time on how they interpret the data because it's all open to interpretation. I want to see what the results of the study were. So all my articles on drpingle.com, if you see citations afterwards, you know, when I'm quoting things like this, the citations link to some sort of public journal article, whether it be from PubMed or whether it be an actual published journal. But that's what you want to look for, okay? So I hope that helps. PubMed.gov, okay? I think most doctors don't take these facts into consideration. They only prescribe some drugs and don't care when the drug doesn't help. Most doctors say that it normally helps and you are an exception. Very few doctors think like you do. Yeah, I think there's a holistic viewpoint. If you don't have proper nutrition and you don't have proper function in your body, a certain drug won't work. Think about what drugs do. They have a particular mechanism of action, right? So they've extracted from wherever they've extracted from for this drug to do a certain thing, to act against a certain thing based on laboratory studies and human studies and whatnot. So they're looking for a specific action. So a lot of the times the action that they're trying to block or stimulate also requires nutrition. So if you're trying to send a reaction A plus B to C, and you're giving extra B, let's say by this drug, there's a lot of little nutrients over that arrow that help it go to C that they're often not thought about. So you have to look at all aspects of that reaction and what you're trying to do. So there are many drugs that will not work when someone has a particular nutritional deficiency. And this is why integrative medicine is so important. So important. I want to clarify, I am absolutely not against conventional medicine. I'm not. I think there's a time and a place for everything. I think if we could work together and look at this as a holistic unit and look at the things that we could do nutritionally and lifestyle wise and mix that with the use of pharmaceuticals in the event that it's needed, but we could somewhat prevent it, delay it, or assist it with natural therapies, that's a win-win for everyone. That means better survival, lower death rates, lower disease rates, happier people. I'm all about happy people. You know, but thank you. I appreciate it. You're very welcome. I'm happy to give these videos. Thank you for your comments. Your insurance pays for vitamin D. That's rare, but that's great. Keep getting it checked. I think I got all the others. What should I be looking for with a vitamin D supplement? I think I answered that. Yeah, with the sublingual drops or a very pure capsule. If you missed that, go rewind a little bit and it should be there. Okay? All right. Marie is a cancer survivor. Some doctors saying 2,000 enough for some, up to 5,000. I cannot tell you how much to take based on your health history over social media. I'm so sorry. I wish I could, but you know, my medical board does have restrictions on what I can advise and what I can't. However, I will tell you that you know, with cancer survivors, when you're looking at the dosing, you're looking at what your levels are, right? And where your doctor's trying to keep them. So if they're trying to get them to 60 and you're at 40, then typically they'll raise the dose a little bit, right? To get you to that point and then lower you back down to a maintenance phase. So that's kind of how I go about it. I look at what we have, dose appropriately, raise it up to where I want it, lower dose slightly, try to find that dose that keeps it where it's at. So sometimes it can be a process, Marie. Would I consider doing a discussion on gabapentin for neurological pain and dementia? Maybe. It's not my experience. Let me think on that if there's a way. I have done a couple talks on dementia and Alzheimer's. I don't use gabapentin a lot, so I don't necessarily always feel that I'm the best resource for that, and I don't like to talk on things that I'm not well educated in. But let me chew on that, and I'll see if I can come up with some ideas on that. It's a great suggestion. And having family members they've passed now, but they had dementia, one that's very, very close to my heart. So I could speak about GABA more because gabapentin is a GABA agonist. So I could get you more information on the neurotransmitter GABA and how that would help in that situation. So maybe that's how I can go about it. Right, Lori? All right. Okay, guys, I'm out of here. Nice to see you all. I'll be back tomorrow. Thank you all for following. For those of you that are new here, I'm Dr. Tricia Pingle. You can find the article on vitamin D at drpingle.com, in addition to tons of other articles with videos embedded. I also have a YouTube channel, Dr. Tricia Pingle. And if you're watching me on Instagram, I have a Facebook at Dr. Tricia Pingle. If you're watching me on Facebook, I have an Instagram at Dr. Pingle. So please check them all out. Very good to see all of you returners, and nice to see some new names out there. Have a fantastic rest of your day. I'll talk to you later. Bye-bye now.